Hello and welcome to this episode in our series on neurodevelopmental disorders. In this episode, we will try to address one of the important things related to autism spectrum disorder or autism in short. One of the questions what parents ask is what kind of treatment is available for my child who has autism? When do I start this treatment? How long is the treatment going to take? Do you think I should have a special diet for my child? These are some of the questions we will pose to our expert to get some information. Come, let us meet our expert.
So, as we know, autism is a developmental condition. Children have difficulties in particular domains of development, mainly social domains, language domains. So, therapies or treatment when it comes to, mainly it is about therapy interventions in the form of speech therapy, occupational therapy, other naturalistic home-based interventions that can be provided in the home environment of the child. So, this is what the main evidence base lies in. Other than that, medications are also used, but medications do not cure autism. They may help control some behaviors that can be problematic when it comes to autism spectrum disorder. Yes, so one thing parents must know is that the earlier the better, because in very young children, the brain is still growing. There is a lot of scope for improvement. There is research also says that the earlier we start, the better the outcomes are. Children learn these skills very faster than older individuals. But at the same time, parents must realize that it is never too late to start. So you must never lose hope saying that, we have lost the window, the golden period and everything is gone. So we can begin where the child is now. So, one thing that I would like to tell the parents is that you are the primary therapist for your child. Whether it is the speech therapist, occupational therapist, the child psychologist, child psychiatrist, pediatrician, everybody else around you is there to guide you. Even if you take your child to a speech therapy center, they are there to guide you because they are there with the child only for an hour. But whereas you are there with your child 24/7, even research tells us that interventions when they are delivered by family or parents at home, in the home environment which is familiar, where there are ample opportunities to teach different skills to child, that gives the maximum benefit in terms of progress. It is not about that 1 hour of therapy. It is about small activities that parents can carry out in the day-to-day routine of the child, whether it is while bathing, while playing. So these activities can be used as opportunities to teach different skills. It is important that parents learn these skills from the therapist. The other thing that parents must always remember that it is not necessary to force the child to sit for an hour of therapy session. All these interventions, when we say naturalistic, we mean that it has to be in the child's natural environment and we have to take the child's lead, not the other way around. If the child, we can plan these interventions or these skill teaching exercises when the child is in a good mood. The child is in the interest, having some interest to play at that point of time. Child has slept well, is less cranky. Those are time pockets that the parents must make the maximum utility of. So all these things which I said, these come under the umbrella term of naturalistic interventions, which have the maximum scientific evidence that will help children with autism learn and develop skills. Parents must understand that even before children start talking and using their words to communicate, they communicate non-verbally. They point, they gather the parents' attention, they try to communicate by gestures, by emotional expression. So it is very important that before the child learns to talk, some of these pre-linguistic skills, the pre-talking skills as we call, these have to be learnt by the child. So there is often parents say that if we focus on these kind of non-verbal communication, my child will never talk, but that is not true. In fact, if the child gains the pre-linguistic skills, that's when that will pave way to the child learning more of speech. So focus more on the pre-linguistic skills, or you can discuss with your speech therapist in detail about what pre-linguistic skills may be useful for your child. If the child learns those, the child may be able to learn and communicate via speech through over a period of time. So I am aware that many parents put their children on special diets. Some commonly known are GFCF diet, which is gluten-free, casein-free diet. There is not enough confirmatory evidence that this will help in curing the child of autism symptoms, or whether it will cause any improvement. There is not confirmatory evidence as yet. So we strongly suggest that let the child eat everything that is prepared at home, unless and until, of course, the child is allergic to a particular food item. You can consult your pediatrician to know more. When it comes to autism, I think cure is not a very helpful word for parents to use. Another helpful word is progress, improvement. I think those are more useful terminologies to use. So parents must always see what was my child not able to do before and now what he is able to do. So what has my child gained? That is a better perspective to take rather than cure. When we think about autism spectrum disorder, we know that there are some difficulties or challenges that children or individuals have when it comes to social communication or interactions or language. So it is about the child learning these skills with the help of specialists and with the help of his or her family. So let's not look at cure per se, let us look at how much we can help the child gain more and more of these skills so that the child can reach his or her best potential in the future. When it comes to medication, there is no medication that can cure autism. In fact, medications are definitely used in autism, but when there are some other behavioral problems, say for example, if there is hyperactivity, or if there are some repetitive behaviors, or if the child has some self-hitting, self-biting kind of behaviors, or if there are sleep disturbances, in those cases definitely medications can help with all these kind of problems, and you must consult your doctor to understand more of whether if your child has any of these problems, whether there would be any medicine that will help the child. But there is no medicine that can cure autism. So as of now, there isn't enough evidence to support the fact that stem cell therapy will help cure autism. There are many centers which say that, but there is a guideline by National Medical Commission which says that stem cell therapy is not recommended at this point of time because we do not have enough scientific evidence that it helps. Also, they have said that promoting and advertising about stem cell therapy is a professional misconduct. So parents must realize that it is not a cure for autism and it is currently in research phases. And it needs to be evaluated and studied further. As of now, there is inadequate evidence for the same. So when we look at autism spectrum disorder, now what people have started to say is that there is a lifespan approach. So the same person with autism may have different needs as a young child, as a middle in the middle childhood, in adolescence, in adulthood, as an elderly person. There are many different challenges that the person may have across the lifespan. So it is not about 1 year or 2 years or whatever. As a young child, the needs are different. It is about communication, basic communication skills. So those kind of therapies which I already mentioned, they may be helpful. Speech therapy, occupational therapies, those may be helpful in young children. But as the person with autism, the individual grows up, the needs may change. In adolescence, there can be other anxiety symptoms, there can be other mental health concerns, they may have some socialization difficulties. So those can be addressed as and when the person grows, so that we can help the person go across all these challenges that he or she may face. One thing I also want to point out to parents is that just don't look at a deficit based approach to your child, that my child has this problem, that problem. Your child also has many strengths. It is important that parents also look at what are the positives of my child as a person, how he or she is, and we must help the child harness those strengths that each child with autism will have. So it's very important that parents know. Also, there is not a one size fits all kind of a thing for autism. Each person with autism is different. Their needs are different, their co-occurring problems are different. So it is important that therapies and interventions are tailor-made for a particular child based on his or her needs. So it is very important that you seek the right kind of professional advice for the same.
This concludes our episode on treatment options in autism. We learned some important information about when to start treatment, how long the treatment might take, what are the treatment options, is stem cell therapy a viable option, what kind of diet should be given to the child, etc. We'll be back with our next episode. Namaste.